safety and wellbeing in the workplace, an introduction to ISO 45003. My name is Holly Mulvihill-Clark and I'm Head of Learning and Development here at IIRSM. Your speaker today is Kate Field from BSI, who is their Global Director of Health, Safety and Wellbeing. Thank you for joining us today, Kate.
It's my pleasure, and thank you for inviting me.
No worries. Before I hand over, there are just a few housekeeping type things that I need to run through first. So to begin with, you'll be on mute for the duration of the webinar. But if you have any questions, please do feel free to pop these into the questions area, and we will take 10 minutes at the end of Kate's presentation to address those. For help or guidance using the system, you can click the I symbol on your toolbar and you'll be directed to the support site where you'll be able to find further information. And finally, this webinar is being recorded and a copy of the recording will be placed on the IIRSM YouTube channel after the event. Okay, Kate, that's enough from me. So I'm just going to hand over and make you the presenter so that you can share your screen with us.
Lovely. Thank you very much.
Brilliant. We can see that.
Great. Brilliant. So if I just get ourselves into presenter mode, then we can get going. And that's where the technology is being slow to think about it. Go on. There we go.
There we go.
Perfect. Great. Thank you very much, Holly. And as I said, thank you very much for the invitation to come and speak to you all. It's great to see so many of you on the call. So for those of you who don't know me, I'd say thank you first of all to Holly for promoting me to director. My formal title is Global Head of Health, Safety and Wellbeing at BSI, British Standards Institution. And my role is external focused, so I don't look after BSI's internal health, safety and wellbeing, although I support very much our teams that do. My role is external focused to really help and support our clients and the wider stakeholders to really deliver best practice in health, safety and wellbeing. And I've been working as a health, safety and wellbeing professional for a long time now. I'm not going to say how many years because that starts to age me, although I could say I started at 10, which might make it better. And I've worked across nearly all industry sectors. I've worked globally. I've worked in public, private and third sector organisations, but I started my career as a regulator. So I worked for the HSE as an inspector before going on to work on some of their health programs and particularly around psychological health and safety, so stress management, when they were introduced a number of years ago. So this is something that's very close to my heart and has been very much a key part of what I've been doing. So for those of you who maybe aren't familiar with BSI, we have been future ready since 1901. So this is actually where we started. We developed the world's first standard in 1901, and standards development remains at the heart of what we do. But we've also developed that into more client-focused services in terms of assurance, the certification and training, and also particularly focused in an area on medical devices, our regulatory services, and we also offer a whole range of consultancy services across the entire portfolio of what we do. And from a health, safety and wellbeing point of view, we cover all of those across all of our different services, as well as additional services, particularly around digital tools and digital assurance. So it's very wide ranging. But you're here to understand more about psychological health and safety. And I think it's just worth reflecting that BSI has been prioritising people for a very long time. It's definitely inbuilt into our DNA, from the development of the first health and safety management standard, which became then 18,001, that then became 45,001. The publicly available standard on COVID safe working that we wrote last year that became ISO PAS 45005, and actually we manage the ISO technical committee that does all of the work on health and safety management standards. And wider than just health, safety and wellbeing, we also develop standards in broader people space, and a good example of that is the one on diversity and inclusion, which has become an international standard this year. So it's very very much built into what we do, and therefore, you know, it sits really well with me. And we're governed by a raw charter, and in simple terms, that's to make the world a better place. So it's great to work for an organisation that looks to achieve that. So, psychological health. I thought I'd provide a little bit of context before we get into the detail of ISO 45003, the new international standard on psychological health and safety, just so that we're all on the same page. So, what is psychological health or mental health? So we use the term at an international level, psychological, because mental health has different interpretations and meanings in different parts of the world, which is why we talk about psychological health, but you know, that is also mental health. So our mental health influences how we think and feel about ourselves, about others, and how we interpret the events around us. So it's really critical. It affects our capacity to learn, communicate, to form sustained and end relationships. And really importantly, it influences our ability to cope with change, transition, and life events. And I think, you know, the pandemic of what's going on for nearly 2 years now has really started to show how important our mental health is in terms of dealing with, you know, significant disruption. And good mental health is as important as good physical health to our overall life and our broader sense of well-being. And work is a really important part of this mix. It's really important from both our physical and mental health point of view. You know, there are numerous studies internationally that show very clearly that people who are in work are overall healthier and happier. And of course, that has a knock-on impact into the wider society. So, you know, somebody who is earning an income is then maybe able to fund additional activities for their children, you know, sports activities or additional education, or to access health services if they become well for other reasons. So, you know, the implication of being at work is really positive. So what we should be aiming to do within a work context is create an environment that fosters this positive psychological mental health and eliminates or minimises any work-related causes which can have a negative impact. And that is the flip side, is that being in work overall is better for our physical and mental health, but of course there are implications and potential risks that need to be managed to make sure that that benefit is realised. So just in terms of thinking about the negative implications of poor psychological health, so particularly looking at mental illness, it runs on exactly the same continuum as our physical health, you know, through from absolutely great, fighting fit, through to feeling, you know, maybe not great, but okay, feeling a bit, actually, no, I maybe need a little bit of time off, or I need a little bit of medication, through to more serious illness. It's exactly the same continuum, which means that we all experience really good mental health, but that also means that we all have times when our mental health might not be so great. And I think it's important to recognize that. And, you know, it doesn't mean that we can't function in our lives, at work, in the wider society. So the way I tend to talk about this is that, you know, we might have days I tend to talk about it from a physical point of view to give some context. So we might have days where actually we just feel a little bit under the weather. And maybe our concentrations are a little bit low, you know, we're maybe not quite as productive as we need a little bit of rest, but it doesn't really have a significant impact, but we know we're not maybe 100%. Then we have times from a physical health point of view where, and this is always a slightly different, because I used to talk about just having a cold, but of course now we have COVID-19 within the mix. But that sort of context of, you know, we might have a mild virus that makes us feel poorly for a couple of days. We maybe have a couple of days off work, we rest up in bed, drink lots of fluids, and we recover. We might, within that context, have something more serious, a more serious form of COVID-19 or of the flu. That's the big thing at the moment, where actually we're poorly for longer, you know, a few days, maybe a week, and actually we need some over-the-counter medication to help, some paracetamol or something like that. Then we might have physical illness, something like maybe diabetes, where actually, you know, it can be well managed with regular medication, regular treatment, good, if you like, self-care, eating well, not, you know, not eating the wrong things, and again, means that we can continue to function perfectly well, but we just have something to manage. And then, of course, we might have more severe illnesses that are either more serious, requiring more significant medical intervention, or potentially have the potential to be fatal. And it's exactly that same spectrum when it comes to mental illness. And it's important that we recognise that. I think sometimes there's so much stigma and misconception around mental ill health. You know, we only think about diagnosed mental illness, you know, anxiety, depression, schizophrenia, and post-traumatic stress disorder. They are all part of mental illness, but they are to the other end of the scale, whereas most of us, as with our physical health, encounter it in kind of, you know, the routine, actually just not feeling great sometimes. So I wanted to give that context before we get into the detail, and I also wanted to give some context around stress. And I'm sure a lot of you know this, but I want to make sure we're kind of all on the same page as we go forward. And you may be thinking about, well, why are we talking about stress? Where's this come from? And it'll become clear in a moment. So first of all, what is stress? Well, stress is a fantastic thing, absolutely incredible thing. It's our inbuilt safety mechanism within our own bodies, within our DNA. It's designed as a safety mechanism to keep us safe. In simple terms, it's our fight or flight response. So it's our body's natural inbuilt ability to keep us safe in moments of stress, a response. It prepares us for that fight or that flight. It's perfectly natural. As I said, it's kind of inbuilt into our DNA. Quite often we don't even know that our bodies has gone into that stress response. And it has a whole kind of chain reaction. So it sort of starts with initially kind of like a chemical reaction. So we get things like adrenaline and cortisol released into the body. Then that creates a chain of physical impacts. So things like it will increase our heart rate. Part of that will potentially get a little bit sweaty. Our heart will beat faster. As I said, you know, you will maybe get an upset tummy, and our muscles will tense. Ready for that fight or flight. And it's completely automatic. There's nothing that we can really do to manage that. And as I've said, quite often we don't even notice it. And stress, as I say, is a really good thing. It's the thing that enables a parent to look after their child when they've had, you know, an hour's sleep. It's the thing that allows maybe something like an airline pilot to deal with an emergency situation and make the right decisions. It's a trained response within athletes. So particularly for athletes, you know, when the starting gun goes off, that's a stress response. When I'm presenting, I am having a stress response. I do a lot of presenting, but I still have that stress response because it's kind of our body's a way of just being a little bit more alert, a little bit more ready for what's coming. So it's great, really good. The issue comes with stress is when we have too much of it, when it's prolonged or repeated over a period of time, and at that point it can start to have harmful effects on our physical and mental health, and this is just a kind of a summary of that. So it has kind of acute short-term impacts and then sort of chronic, those long-term impacts. So from sort of an initial point of view, it has impacts on our mental and cognitive abilities. So, we can feel more negative or have sort of anxious feelings. We tend to be more emotional. It really impacts our things like our ability to learn, to take in information, to make decisions, affects our memory. And of course, it can impact our motivation and commitment. Physical, whole range. I've touched on kind of a number of them already, because your heart rate increases, so you get that flushing, you get that sweating, muscle tension because your body's ready to run down. But also, if your body's in that kind of state all the time, you'll feel run down because it's in this constant state of ready to go, and it can't keep that up. But it also affects us from a behavioural point of view. So it can change our eating habits. We can eat more, we can eat less. The same for our sleeping. We can sleep more, we can have issues with insomnia. We often try and deal with stress by maybe drinking more alcohol, or smoking, or taking drugs. And also it often affects our appearance. If we're dealing with stress, we tend to not care so much about how we look. So we stop shaving, not showering as much, all of those sorts of things. But the challenge is if those acute symptoms and the causes of stress are not addressed, and it either is continued over a long period of time or repeated regularly over a long period of time, it starts to have more serious implications. So this is where you get this relationship with mental ill health, and it can lead to things like anxiety, depression, and post-traumatic stress disorder. Can lead to more serious forms of physical illness, things like irritable bowel syndrome, cardiovascular ill health. It affects our immune system. It can have impacts on our musculoskeletal system, on our skin, and the behavioural impacts obviously can take a toll as well. So if we're eating or not eating, can lead to obesity or emancipation. I think we're probably all aware of the implications of not getting enough sleep on our short-term and long-term health, and obviously the potential risk if we are relying on things like drugs and alcohol, the challenges that can arise from that in terms of addiction and overdose. So I wanted to set that scene before we get into the detail of psychological health and safety management. And within the context of the last couple of years, I think it's really brought to the fore the necessity of organisations to really focus on their employees' mental health and really help and support them. The pandemic has had a huge impact on organisations, and as a result of that on the people that they either support and help or of course employ. So psychological health and safety has been, I think, one of the areas that has gained more focus, which is really positive, but also creates some real challenges for us. So before I go on to start deep diving into psychological health and safety, we're just going to play a short video to start to put this in the context of mental health within the workplace. So over to you, Holly, for the video, please.
Thank you. I will just get sorted with that. Bear with me one moment. Okay, and the video is just loading on the screen.
When we talk about psychological health and safety within the workplace, we use a specific term, psychosocial risks. Psychosocial risks are factors within the workplace and the work we do that can negatively impact a worker's psychological and physical health, or put even more simply, have a negative impact on physical, mental, cognitive or emotional health. Psychosocial risks include the way we work, such as workloads, deadlines, the type of work, isolation and work-life balance. It also includes social factors within an organisation, such as culture, working relationships, bullying, harassment, fairness, and even career development. Other physical and mental hazards such as high noise, thermal discomfort, physical pain from musculoskeletal disorders, fear of violence and aggression, or even witnessing an incident can also give rise to psychosocial risks. The negative impact that psychosocial risks can cause tend to build up over time, weeks or even months. It can cause physical ill health such as increased blood pressure, gastrointestinal problems, a weakened immune system, and even impact our reproductive health. It can cause mental ill health, including anxiety, depression, and post-traumatic stress disorder. It even has cognitive impacts, including confusion, indecision, poor memory, and concentration. Finally, psychosocial risks can affect our emotions, causing mood swings, negative feelings, loss of confidence and motivation, and even changing our eating, drinking, and sleeping patterns. But psychological health and safety management is about more than just preventing these negative impacts. It is also about creating a workplace where an individual can flourish. Creating this environment is where the true organisational benefits lie, as unlocking people's potential also unlocks your organisation's potential.
Okay, I'll hand back presenting rights to you now, Kate.
Lovely, thank you, Holly. Great, so hopefully you're back in. So the reason I wanted to set the context is hopefully starting to become very clear now. So when we talk about psychological health and safety, we use this term psychosocial risks. And as you heard in that video, it's a kind of a combination. Psychosocial is a combination of those factors within our work that affect our psychological and our social response. And one of the key outputs of that psychosocial response is stress. So these psychosocial risks, one of the primary things that happens is they trigger our stress response. And this is why we sometimes will talk about occupational stress. That is the same thing, you know, work-related causes of mental ill health, they're all related to these psychosocial risks. And the primary reason is they activate this stress response within our body. So that is a risk factor in itself, and a very significant one. But as you heard in the video, you know, there is then a relationship between our stress response and our other forms of physical ill health. So, you know, particularly musculoskeletal disorders. So you've probably, have you all experienced when you're stressed, or you know, when you're feeling under pressure, maybe when you're typing on the computer and you type harder, or your shoulders are all scrunched up? That is a stress response, but of course it's physical. So if you imagine, if you're then doing maybe a very physical activity, you've got kind of you're using your body for the physical activity, but it's also under this response from a stress point of view. So it's accumulative. And of course, you know, some forms of physical risk will lead to not just physical harm, but also potential mental ill health. So things like violence, but also noise or thermal discomfort. So, you know, if you feel very cold or very hot, then actually it can be difficult to concentrate because you're thinking about the heat. And if you think about noise, if I were to say to you, imagine somebody pulling their nails down a blackboard, the sound that it makes, and a lot of you will be going, oh, hey, that reaction is a stress response. So think about that within a workplace. You know, it might not be as obvious as that, but that response is there. But importantly, and I think this is one of the things that I've always found most interesting, and I've always looked as health and safety as just one of the forms of risk management organisations should do, but it's always pulled out separately for some reason, but it's just about risk management. And when we think about psychosocial risks, we start to understand the context of risk management within the workplace, because one of the biggest impacts is often kind of an unseen or hidden impact. And if you think back to when I talked about kind of some of the outputs of negative outputs of stress, I said things like it affects our memory, it affects our ability to learn, it affects our concentration, it affects our decision making. And within the context of an organisation, risk management, this becomes problematic because it can lead to human failure, human error, so making more mistakes. And obviously that has implications across the whole of the service or product portfolio that you're delivering, so it can impact the quality of products, the quality of services, your financial management, any sort of decision making, as well as obviously sort of the health and safety risks. And this is one of the key areas that's really overlooked and really not recognized, because it's often hidden, when organizations, when they maybe identify an issue with quality in a product, they don't often, on their root cause analysis, go back and look at the psychosocial harm that might be one of the root causes of that. So this is why it's really important within the context of wider business risk. So we're talking about psychological health and safety and these psychosocial risks. And one of the things I've always found really interesting is that it is possible to spot it in an organization once you know what to look for. I mean, I've been doing and focused on this area particularly for a number of years. I can walk into an organisation and walk around to get a sense about whether occupational stress, psychosocial health and safety is being well managed or is an issue or not. You can see it, you can almost feel it in the air, and that's because people are reacting, and if you know what to look for, you can see it. So you can see changes in behaviour. People might be more extrovert, they might be more withdrawn. There's maybe a lack of energy, lack of productivity within an organisation. People maybe, as I've mentioned, neglect their sort of physical appearance. There are more obvious signs in terms of absence, and at the moment there's a lot of talk about burnout as well as absence from other forms of mental ill health. You have, because people are unhappy, they leave. You have these issues in terms of performance that I've touched on. Quality, productivity, lateness in terms of delivery of work. The other thing that's really interesting is you get a lot more niggles or formal complaints and grievances between people within the workplace, but also with customers. If you are customer facing and you are feeling the negative impacts of stress, then you are unlikely to give really good customer service, and therefore you get an increase in complaints. You see it in terms of increase in bullying, harassment, as well as again, more obvious signs where you may actually get an increase of frequency around incidents or errors. And some of this list on the screen here is taken from ISO 45001. So then the question comes to this, if I mentioned that we've had an increased focus on psychological health and safety because of COVID-19, but the reality is that poor mental health management within the workplace has been an issue for a number of years. If you can remember back before COVID-19, now, but even before COVID-19, that some of the highest causes of absence within workplaces was occupational stress and work-related mental ill health, and this costs organisations and global economies billions and billions of pounds every year. So the question then is, why do organisations struggle to manage psychological health and safety within the workplace? And I think there's kind of three core issues, but an underlying issue. The underlying issue is the stigma and misunderstanding that's associated with mental health, because of this relationship between psychological health and safety and mental health. You know, that stigma around mental ill health stops organisations wanting to really look at this and tackle it within their own organisations. And from an organisational point of view, they don't understand the issues. They don't understand what it is about their work and their workplace that is giving rise to psychological ill health. It's seen very much as, you know, an individual issue. Somebody's, you know, weak or broken or not strong enough, rather than really looking at the organisational causes. And therefore, organisations don't know what actions to take, and therefore they don't actually take any action to manage it. So this is where ISO 45003 comes in. So this was published in the summer this year. It is the new international standard on psychological health and safety, managing psychosocial risk in the workplace. Lovely snazzy title. As with all international standards, it's been aligned to key SDGs, and you can see those on the slide. But as with other international standards, so other ones you might be familiar with, you know, 9001 for quality, 14001 for environmental, 27001 for cyber, and of course 45001 for occupational health and safety. It follows the same high-level structure. And it's designed as a practical how-to guide on managing psychological health and safety, and it's been designed to be accessible and relevant to all types of organisation, all sizes, all sectors, wherever you are in the world. And the other thing just to reflect on is that it's a guideline standard. So the weird and wonderful world of standards, there are different criteria for standards. So there are your main management system standards, and they're called requirement standards. So the ones I've mentioned, 9014 and 45, and they have a particular status. And if organisations seek to get third-party certification from an organisation like BSI has to be accredited. So we have to demonstrate that we have, in simple terms, quality management processes to ensure the integrity, consistency and the quality of that certification. So we have to be accredited. With other forms of standards, so like guideline standards, that accreditation isn't required. It's just a quirk of it. All that, so from a BSI's point of view, we are delivering this as a certification. We don't need to be accredited, so the only difference for you is you don't see, for instance, the accreditation badge on your certificate, UCAS or ANAB. We deliver it to the same standard, but it is a quirk of ISOs which is worth being aware of. So I mentioned it covers the same high-level structure as other international standards, and here's just an overview of it. So if you are familiar with this structure, and particularly if you're familiar with 45001, this will look very familiar. And you can see that there are a couple of additions for 45003. Just bear with. My voice gives out. You can see there's some additional focus on internal and external issues, and a whole new clause on rehabilitation and return to work, which I will come on to. So what does 45003 cover? So it really aims to identify and answer those questions that I had at the beginning. So organisations don't know what they are, and therefore they don't know what to do, and therefore they don't take any action. So 45003 is aimed to address that. It aims to help organisations understand what they are and how to recognise it. So it gives actually nearly 3 pages, 3 tables of examples of psychosocial risk, and you can see just an extract of that on the screen there. So it gives very clear guidance about what these psychosocial risks are to help organisations identify them. It then provides guidance about actions to take. and in particular focus on a hierarchy of prevention, so aiming to eliminate it or manage it where it can't be eliminated, and then look to strive for continual improvement. So that whole plan, do, check, act that we're very, very familiar from a risk management point of view. So that is the standard, and as I say, is really designed to break down the barriers to addressing this within organisations. And for those of you who work very directly in terms of health and safety, you may be thinking to yourself, oh, so how does this relate to 45001, which is the international standard on occupational health and safety management? So it was written by the same committee, same international committee, and it has been designed to complement and support 45001. Now, in an ideal world, when we are looking at health and safety management within an organisation, we would be managing psychosocial risk already. It's not a new risk. So I'm going to give the game away in terms of my age a little bit, but I've been doing this for 20 plus years, and psychosocial risk has always been an issue. This is not something new. It's just that organisations have really failed to tackle it and address it effectively. And although 45001 talks about some of these psychosocial risks, it doesn't use that phrase, but under Clause 6, when it talks about identifying some of the hazards within your workplace, it lists some of the most common psychosocial ones. So it talks about things like bullying, working hours, the culture of the organisation, and leadership. But there's a recognition by the International Committee, and I'm sure if you work in this area, that we're just not good enough at managing psychosocial risks. So 45003 was written to support 45001 and ensure that organisations really effectively manage psychosocial risks within their organisation. So it is designed to be used with 45001, but you don't have to have 45001 in order to get the benefits from 45003. You can use it almost as a standalone standard, but you do need some sort of health and safety management system approach, because it's designed to follow that same plan, do, check, act. And as I mentioned, there is this very clear relationship between, what might be traditional health and safety risks, so noise, musculoskeletal disorders, and psychosocial risks. So you need to manage them collectively. But to get the value from 45003, you don't have to have 45001. So the other thing that's worth reflecting on, and I've heard a lot of concerns, I think one of the potential barriers to organisations looking at psychosocial risk is a concern about competency needs. We use this term psychosocial, psychological, we talk about mental health, we might talk about stress, and I think there's a misconception that means that you need to be some sort of professor in psychology or doctor in psychology or mental health, and you don't at all. This is about risk management. This is at the heart of what we do. It's about identifying what can potentially be an issue, assessing, analysing who can be impacted by that, and coming up with a strategy for dealing with it. And within the context of psychological health and risk management, it's health and safety risk management. You don't need to do anything else. So if you are managing risk, and particularly if you're managing health and safety within your organisation, you don't need any additional or specific competencies apart from really understanding what these psychosocial risks are. So that's our gap, understanding what they are. And actually, as you start to understand what they are, what causes them, it becomes quite easy to start to identify what to do about them. But of course, 45003 provides additional guidance for that. So you approach the risk management in exactly the same way as you would for any other health and safety risk. So we don't need anything different. I think the only addition that we need to be aware of with psychological health and safety is that it does need input from health and safety professionals, because it's about health and safety risk management, but also your people or HR, because it touches on things like, bullying, harassment, discrimination, career development, aspects that might fall under HR remit. So therefore, that's kind of the only difference, that is these things should be working together. To be honest, when we're looking at risk management, we shouldn't be working in silos anyway. We should be working cross-functionally, but I know that that's not always the case. But for psychological health and safety, you really do need that cross-functional team, and you might include occupational health or occupational hygiene or other forms of risk management, depending on how your organisation is set up. So it's a health and safety management system based on 45001, but there are, if you like, some sort of notable differences, or additions is probably more accurate. It goes into more detail. And one of the things it really focuses on is ensuring that its organisations are taking action at an organisational level. One of the things that we've seen with sort of mental ill health within the workplace is a lot of organisations are focused on the individual. That we have resilience training to make people cope better. We have mental awareness training so people understand, and there's value in those things, but they are not addressing the root cause of the issue. And quite often, this is linked to things like wellbeing activities. So we have Puppy Fridays, where puppies are brought into the organisation, and everybody feels happy for a little while because puppies are really cute and it makes them feel better, if you're not allergic, of course. But if you go back to your desk and then you're bullied by your boss, then quite frankly, the puppies aren't going to really help, apart from distract you for a little bit. So 45003 is about ensuring that organisations are identifying the organisational causes of psychological ill health and taking organisational action. And a really good way to explain this is actually to use a safety example. So if we think about fire safety within an organisation has to identify what its risks are from fire. What can cause a fire, what fuel there is within the organisation, and take action to either eliminate it or mitigate it. So we have then our fire alarm systems, smoke detectors, sprinkler systems, fire doors, all of those sorts of things. Then we have people to help, so we train up our fire wardens, and then we train everybody to understand and help with that risk management. So we train people to look for potential fire risks, and then what to do if there's a problem, and then practice that. We have drills, evacuation drills. And it's the same here with psychological health and safety. We are looking at those organisational level issues. Now, within the context of fire safety, when it comes to the last bit, the evacuation, so when there is a really significant risk, there may be people that need additional support to evacuate safely from the building. They may have some sort of temporary or permanent mobility, which means that they are increased risk. So somebody might have sprained their ankle and they're on crutches, so a short-term mobility issue, or of course somebody may have maybe in a wheelchair, or somebody may have a hearing impairment, so they can't hear a fire alarm, so you have to put a visual alarm in. That's organisational level action, but just reflecting that there are some people who might need a little bit of extra help and support within the context of a specific risk. And that is exactly the same for psychological health and safety. And as part of that, then there's a real emphasis on diversity. A lot of these psychosocial risks will impact different groups in different ways. And unless you take that diversity into account, you will never effectively manage at an organisational level psychological risk. So, the experience of bullying and harassment between different genders, different ethnic groups, different ages within the workplace, even things like full-time versus part-time workers will potentially be very different. So you need to encompass and think about that diversity. It talks about hierarchy of controls and references what we we traditionally think of as a hierarchy of controls in occupational health and safety, elimination through to personal protective equipment, but it also uses a new terminology, primary, secondary and tertiary, and this really reflects and comes from kind of, if you like, the healthcare setting, and the principles are the same. So primary interventions are really about eliminating it or minimizing it to its lowest possible level. Secondary interventions are really what we might think of as sort of administrative control. So that's your policy, your processes, your training that goes with it. But the one that's different is tertiary, and if you like, they are reactive interventions, which comes on to this last point, which is an addition and really focused on then the rehabilitation and return to work. And one of the things that we know, again, from lots of research around the world, is that actually, whether it's physical or mental ill health, the longer somebody is off work, the less likely they are to re-enter employment. So we've got to have really effective processes for ideally supporting somebody to stay in work, if that's possible, maybe making some reasonable adjustments, changing their working hours, reducing their workload, or if they need time off, ensuring that we've got really effective processes for keeping in touch and looking to bring them back into the workplace as soon as possible, again making reasonable adjustments, perhaps a phased return to work or working part-time. It's a really critical element, and as I said, you know, that's true whether it's physical or mental, but we know that because of the stigma and discrimination around mental ill health, if the outcome, the illness caused by psychological exposure, psychological risk exposure in work is mental ill health, so anxiety, depression, then actually it becomes even harder to re-enter the workplace after being absent. And of course, if we get this right, there are key benefits for organisations and the individual. And I'm not going to go all the way through this slide because you're all risk management professionals. You know this. You've had these conversations within your organisations. You know the benefits of good risk management. But you know, it is sometimes we need to reflect on that, and we need to ensure organisations and leadership really understand that. And quite often there's aspects that are not really recognised from this point of view. So, you know, actually, if we have good psychological risk management, we tend to have a more inclusive workforce. If we have a more inclusive workforce, we tend to have more creativity, which actually drives innovation within an organisation. Again, there's lots of research that shows that. So there's a very clear link, if you like, between looking after your people, prioritising your people, and delivering business benefits. And then, of course, there's a whole range of additional research that's out there that kind of does the return on investment. So what's the financial implications? This one is a study from Deloitte last year, and they showed that for every £1 an organisation spent on mental health interventions within the workplace, they got £5 back in terms of reduced absence, presentees and staff turnover. So there's, you know, there's very good evidence for the business case on this. So one of the challenges that we're seeing as an impact of COVID-19 and organisations not looking after their people, and particularly not looking after their psychological health and safety, is people have got fed up and unhappy and are leaving. You may have heard the phrase, the great resignation. But of course, if you get this right, then you can turn that into the great retention and the great recruitment, so keeping and attracting new talent. And 45003 talks about well-being. So it's not a well-being standard in its own right. It is a standard focused on psychological health and safety. But if you get psychological health and safety management right, then you are contributing to enhancing the well-being within an organisation. And 45003 does provide a definition of well-being, and you can see it on the screen: the fulfilment of the physical, mental, social and cognitive needs and expectations of a worker related to their work. So again, just to reiterate, the promotion of well-being by the management of a risk. So when we look at wellbeing, what does that mean then? So wellbeing is really about creating the right conditions for an individual to feel fulfilled. But at the heart of this, the heart of good psychological risk management and good wellbeing strategies is about creating a culture of trust. And to help organisations really understand what needs to be done and focusing on what those needs and expectations are, BSI has developed the Prioritising People model, and this is a best practice framework for workplace wellbeing. So it breaks, if you're familiar with Maslow's hierarchy of needs, it uses that framework as a guide. Basic, you've got your basic needs that need to be addressed before you can move on to your psychological needs, before you can reach your fulfillment needs. I haven't got time to go into this in more detail, but I just wanted to make you aware of it. And importantly, it draws that relationship very clearly again in terms of what the benefit is for the individual and what the benefit is for the organisation. If you want to know more about the Prioritising People model, there is a white paper, and actually it's one of the downloads. If you haven't noticed, there are 4 downloads that you can access today, and the white paper is one of them, or you can just search BSI Prioritising People. And if you want more information on 45,003, again, there's a whole range, but a number of the downloads that are available cover that. So that brings me to the end of the main presentation and an opportunity for you to ask questions.
Thank you for that, Kate. It was really informative and also very interesting to hear about how I guess the pandemic has perhaps not accelerated the need, because I think the need has always been there, but increased or emphasised the importance of this whole area in the workplace. As I said at the beginning, if you have got any questions, then please feel free to use the questions area to ask those. We have had a couple come through already. So the first is from John, who said, towards the beginning of the presentation, you mentioned that someone hunched up at their desk might be stressed out, but I guess this is quite an individual thing. So another person could be laying back on their seat to hide their stress in a sense, and I guess it's kind of how to figure out the stress levels of each individual employee.
Yeah, so I think we are all individuals, and we do we do react in different ways, and we also react at different ways at different times of our life. If we've got other stuff going on in our life outside of work, it can be much more difficult then to deal with the stresses that are happening within work. So it is worth bearing that in mind. But this is where really awareness of the issue becomes important. But I have to say, one of the really critical parts of management of psychological health and safety is as the line manager, and a line manager needs good emotional intelligence, and part of that will be then understanding how an employee is in, if you like, when they're feeling good and well, and then recognizing a change in behavior and pattern, and as an indication that something's wrong. And you're absolutely right, John, some people when they're feeling stressed may normally be introvert and they might become extrovert. Might be the other way around. You're right, some people might become withdrawn and kind of look all hunched up. Some people might kind of lay back. So one of the things I do when I'm stressed is I sigh a lot. I huff and I puff. It's really hard, but that's because it's affecting your respiratory system. So there is a combination of educating people so they understand what their reaction is to stress, but also this is where the line manager is so critical to psychological health and safety management. They can be a cause of risk, and they can help manage it, and they can help be an early identifier in case they notice a change with somebody within their team.
Okay, great. And the next question contains some acronyms, which you may mean more to you than they do to me, but I'll read it out and we'll see how it goes. So this is from Ian, and he says, if a certification body identifies a lack of psychosocial risk identification or a lack of adequate management, would the CB raise a minor or major NCR during audits?
CB certification body.
Okay, that makes sense. Yeah.
In simple terms, not non-conformity. So it depends what you're being assessed against, Ian. I think is the answer to that question. If you're being assessed against 45,001 or obviously 45,003, and there is evidence that you're not meeting the required standard, then yeah, absolutely, you'll get an NCR. And obviously whether it's a minor or a major will depend on how serious that missing element is. So it'll be, if it's not having a significant impact on the overall health and safety management, then it's only likely to be a minor. But if it's actually having a significant impact and potentially undermining the outputs of the health and safety management, then it will be a major.
Okay, great. And then we'll take one final question, and that's from Ahmet, who's works for Istanbul Airport. So he says, thank you for the webinar. In connection with ISO 45001, how can an internal auditor assess mental risks associated with personal risk factors during an audit? So will the internal auditor look for risk assessment records for wellbeing and employees' concerns?
So I think there's two aspects to this question. So I think the first one is, what will an internal auditor look for? So you're looking for risk management processes. So are they identifying what the hazards are? Are they assessing what the level of risk are? Are they assessing who's at risk and what action are they taking, and how are they then evaluating and monitoring performance and continually improving? So exactly the same processes as you would normally as an internal auditor. I think the other aspect of the question was around, should an internal auditor be looking at whether an individual is more susceptible? And I suppose the answer to that is yes and no. So as I hope was clear through the presentation, this is about what organisations do at an organisational level. It's about their processes. But of course, within the context of health and safety, there are individuals who may be more vulnerable. We're used to this as health and safety professionals. We're used to looking at, whether new and expectant mothers are classed as potentially vulnerable to some sorts of risks in different ways. Young people with disabilities. It's exactly the same when we're looking at psychological health and safety and mental ill health. It doesn't mean that you're having to look at individual mental health, but you are asking the organisation how they are addressing and identifying if there is anybody at increased vulnerability, and how you are helping and supporting them. It comes back to that point I made when I talked about fire safety risk management. We do this day in and day out, organisational level controls, but recognise that there may be some people in certain circumstances with certain risks who may need a little bit of extra support. So in fire safety, we call it a personal emergency evacuation plan, a PEEP. What is the organisation doing to help and support those individuals who may need a little bit of help and support, either on a temporary basis or longer term? It's about organisational processes, not the individual.
Thank you, Kate. And that's the time we have for questions today. Just to reiterate, as Kate mentioned, from the handout section of the toolbar on the right-hand side of the screen, there are some further resources there which you're welcome to download. And I believe you can also find them on the BSI website should you like any further information. And this recording of this webinar will be available on our YouTube channel within the next 24 hours so that you can recap in your own time should you wish. Kate, thank you so much for sharing your knowledge with us. It was really interesting. And thank you to everyone today for joining and for your questions also. Goodbye.
Bye-bye.